is there a way that you're phrasing questions that we can learn from, that we can ask in a more enlightened way to help patients really explain, and vice versa? How can patients help you kind of be inside their skin a little bit and understand their experience better?
Yeah, I think it's a two-way street there. I mean, to say the patients need to explain themselves better is a little unfair. I think the questions that I use in the office that often get to the heart of the matter as to whether or not they're going to, be great candidates for surgery or not is typically revolves around this idea as to whether or not the symptoms collectively are affecting their quality of life. And it's a very vague term, but usually when you qualify it within the setting of, okay, you've got a 9-year-old child, are we talking about headaches that land them in the nurse's office, 2 or 3 days a week? Are we talking about they've decided that they don't want to do soccer anymore because it hurts every time? Are they not going to play dates? Those are very different metrics than for an adult who you may say, well, are you missing work? Have you stopped going out with your friends? Are you now taking headache medication on a daily basis? Like, whatever those metrics may be, they're different for every person. And I think once you drill down into, are you living the life that you want to be living? Is this affecting you on a daily basis on a way that you feel like you could be living at a higher level on the adult side, and then advocating for children if it's the parent? That usually gets to the heart of the matter as to, whether or not they're right candidates. If it's someone who is managing things decently and, is, living their life with 90%, then usually we all agree pretty clearly that surgery is not right. And very, very rarely is there a circumstance in which Amanda and I don't agree with the family or the patient as to the right time. It's usually self-evident that this is the visit where we're starting to hear a change in the tone. This is becoming debilitating. This is now affecting more than it was 6 months ago. And so having that long-term relationship with the patient and having met them multiple times and followed them over years is really helpful.